first of all, TMD means temporal mandibular disorder. The unfortunate thing is that most people call it TMJ. And TMJ stands for temporal mandibular joint, which we all have a temporal mandibular joint. But the disorder of TMD encompasses much more than just the joint. It encompasses basically the head and neck muscles and a disorder of the head and neck muscles and how they're functioning, and that may be related to how the jaw is balancing with the head. It may be out of balance with the head. It may be just that the patient is clenching at night, and that's leading to muscular problems with the face, the neck, all those sorts of things. So it presents itself in many different ways. Some have sinus symptoms, some have neck pain, some have ear pain, some have eye pain, some just literally their muscles hurt every time they eat too much, their masseters are hurting. It just presents itself in many different ways, and it's a very deceiving disorder that way. And unfortunately, it's not talked about enough out there within our own dental profession even. And so patients don't always know where to go. And they don't always know that that's what they've got. Most of
you're looking for it here.
The symptoms can range from headaches, nauseousness, dizziness, ear pain, eye pain, rigidity of the muscles, not being able to turn the head, a vertigo type of feeling, depression is a big thing I see amongst these people. And a lot of these people are very emotionally spent. They're irritated easily. They don't sleep well. There's just a lot of symptoms that you just don't put together that, why is this coming from here? And it literally can just be from clenching. That can be the only reason. I have many people who don't come in here having had an accident, a whiplash injury, say, or a car accident. They've had none of those things happen to them. Yet the clenching, the micro trauma, is causing the muscular dysfunction, and that's it. So you treat that, you treat the muscles, you treat the dysfunction of the clenching, and they get well. You get the muscular harmony going again, and you get their system back on the right track. In my educational journey with TMD, one of the things that I discovered was that there was this movement disorder treatment that was going on out there. It's not well known, which I can't understand why, but it is not well known. And there's a gentleman named Dr. Brendan Stack who's out in Washington, D.C. area. And I traveled there several years ago to spend a couple of days with him and just see what he was doing, because he is helping a lot of TMD patients. That's what his practice is. It's all TMD treatment. So he's putting orthotics in people's mouths. He's doing nighttime appliances, just as I am in my TMD treatment. But what he found over the years, this gentleman's an older man who's been doing this for 20 plus years. And he found that many of these TMD patients had movement disorders in the form of Parkinson's, Tourette's, dystonia, you name the movement disorder, he's probably dealt with it. And he was finding that through the TMD treatment he was giving them, their movement disorder was getting better. And so the more he did it, the more he realized that this was a fairly reproducible thing, especially for the younger Tourette's patients in particular. I can't stand here and say that every Parkinson's patient is going to be helped, because that would be a lie. But as in Marlene's case, all it took was that orthotic. Now, did I take away her Parkinson's? No, I did not take away her Parkinson's. I simply treated some of the symptoms, but that changed her life. Within 2 weeks, she was functioning as a different person. So is that something that could help a lot of movement disorder people out there? I think so. And that's how I look at it. Not that it's a cure and not that it's for everybody, but perhaps it could help someone else.